the motor nucleus of cranial nerve 3, the motor nucleus of cranial nerve 4, the trochlear is in this area. Then you have the motor nucleus of cranial nerves 5, 6, 7 in the following areas. So there's your 5 for trigeminal, motor of trigeminal, 6 abducen, and 7 motor of 7. So this would be for facial muscles. This is for lateral rectus muscles of the eye. Motor of trigeminal is for muscles for mastication or chewing. Okay. Next you have, if you take a line, so this is about midway of the fourth ventricle, like this, is from these little corners, from here to here, there's a line, and then above the line you have the superior salivary nucleus, and below it is the inferior salivary nucleus. By salivary I mean salivary, you know, the secreting saliva. The superior salivary nucleus is for cranial nerve 7, the visceral motor of cranial nerve 7, so for sublingual glands, submandibular gland, lacrimal gland. Inferior salivary nucleus is for the visceral motor of the cranial nerve 9, which is for parotid gland. Then we have, coming down here, the hypoglossal nucleus, which is for just the somatic motor of hypoglossal nerve for movement of tongue, extrinsic and intrinsic muscles of tongue. Then you have here dorsal motor nucleus of the vagus nerve, and this is the visceral motor of the vagus, so parasympathetic input to the digestive system and cardiorespiratory system. Somewhere here you also have the motor for spinal accessories, somatic motor for trapezius and sternocleidomastoid, and in between here you will have something called nucleus ambiguus, and it's a somatic motor for cranial nerves 9, 10, and 11. So 9 is for, and 10, the somatic motor, is the skeletal muscles of the throat and larynx. And I guess it's going to be a little continuous here because it's also somatic motor for cranial nerve 11 for trapezius and sternocleidomastoid. So that is the nucleus ambiguus, dorsal motor nucleus of vagus, hypoglossal nucleus, somatic motor for cranial nerves 3, 4, 5, 6, 7, superior and inferior salivary nuclei. So there are 3 major sensories. One is going to be within this area. That is your vestibulocochlear for hearing and balance. Another nucleus is in this area here. This is called nucleus of solitary tract or solitary nucleus, solitary. And that is responsible for visceral sensory of cranial nerves 7, 9, and 10. So visceral sensory of 7 is taste for the tongue. For 9 it's the general sensation of the posterior 1/3 of the tongue, so you'll have to look at the previous tutorial to understand what I'm saying. And visceral sensory for vagus 10 is a sensation from the cardiorespiratory and digestive system. And finally, the last sensory is a very long one. That is the sensory for trigeminal, the somatic sensory of trigeminal. It expands here, has a very long portion down here. This is called the mesencephalic portion because it's in the midbrain area. Then the chief portion, and finally located in the pons, and finally the spinal portion comes down the medulla. So these, all of it is for somatic sensory for trigeminal V1, V2, V3. So you remember that for V1 the somatic sensory was the so if this is the head, so V1 was all of this area here, general sensation. Then you had the V2 and then you had V3. So this would be what is this nucleus is for. So in general, the 12 cranial nerves can be grouped into 3 categories. One is pure sensory, one is pure motor, and the last one is mixed. Cranial nerves 1, 2, and 8 are pure sensory. Cranial nerves 3, 4, 6, 11 are pure motor. Cranial nerves 5, 7, 9, and 10 are mixed, have both sensory and motor component, okay?